How long do cosmetic fillers last?
Cosmetic fillers are very effective non-surgical solutions for facial volume issues such as hollow under eyes, lip enhancement, cheek definition, the lack of chin projection, and other problems related to genetics or age-related volume loss. Cosmetic fillers can also treat other issues such as wrinkles, lines, and folds, as well as acne scars and even thinned earlobes. Although filler can be used for many situations, some people have reservations about filler treatment because of concerns about the longevity and about using something they think is not natural in their body. I'll discuss how I counsel my patients who have the same questions and concerns about fillers in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As an eyelid and facial cosmetic surgery specialist, I'm well known for my work with injectable fillers in the delicate upper and lower eyelid area, as well as deeper placement of fillers in the facial bone structure for more natural-looking results, applying a technique called structural volumizing. People often want to improve their appearance caused by loss of volume. As we get older, our faces gradually lose bone, muscle, fat, and soft tissue. In some younger people, a genetic lack of volume in the face, such as in the cheeks and eyes, make them look older and more tired than they actually are. Facial volume loss can also be seen in people who are very athletic, who have very low body fat. This can also be seen if you've lost a lot of weight from diet or weight loss surgery. A lot of people who we see come in requesting fillers which are permanent, so they can avoid having to come back regularly for filler placement. In my surgical practice, I've had patients come from around the world to have me remove permanent and semi-permanent fillers such as silicone and polyacrylamide. In addition, if an infection such as a biofilm were to occur with a semi-permanent or permanent filler, they would have to be removed surgically. The reality is that you can never completely remove this filler material, which means that the possibility of recurrent infections would be more than likely. In my practice, for any procedure, my recommendations are based first on minimizing risk and being able to address any issue that may potentially arise quickly and safely. I don't recommend the use of permanent or semi-permanent fillers. Further, as aging progresses, these fillers will not easily adapt to changing anatomic relationships. There are more than a few celebrities who have publicly expressed regret about having permanent fillers, particularly in their lips. In any discussion about a natural filler, the subject of fat grafting always comes up. In order to address facial volume loss at the bone level, fat grafting simply cannot be used. Fat grafting is placed under the skin, which makes it similarly susceptible to the same issues as superficial filler placement. Healing from fat grafting is unpredictable, with frequent complaints about lumpiness and asymmetry. Fat grafting simply does not meet my criteria for predictability and benefit from the placement at the bone level. My preferred injectable filler material is hyaluronic acid. Hyaluronic acid fillers meet my criteria for safety, predictability, versatility, and reversibility. Hyaluronic acid fillers occur naturally in the body, which significantly lowers the risk of foreign body reaction seen with permanent or semi-permanent fillers. Hyaluronic acid fillers come in a range of thickness and longevity allowing me creative flexibility to help my patients look their best. Hyaluronic acid fillers are also reversible, as they can be dissolved with the injectable enzyme hyaluronidase. How long hyaluronic acid fillers last depend on structure and composition of the filler, as well as an individual's rate of metabolizing the material. I use softer hyaluronic acid fillers in the under eye area for hollow-looking eyes and to camouflage minimal eye bags. Further, I also use it for the enhancement of the lips. These fillers include Restylane, Restylane Silk, Juvederm Ultra. A filler like Juvederm Volbella can be used for vertical lip lines above the upper lip. These fillers last anywhere between 6 to 12 months before they are fully metabolized and need to be reapplied. I often combine fillers in the under eye area with platelet-rich plasma, or PRP, a concentration of wound healing and growth factors derived from your own blood. PRP helps improve the skin quality and skin thickness under the eyes, as well as improve discoloration and pigmentation, which is often seen accompanying hollowing, which is often described as dark under-eye circles. PRP often extends the effective life of filler under the eyes, and the two materials work well together. Fillers in a medium thickness and viscosity are often used for the nasolabial folds, the folds around the upper mouth and lower nose, often referred to as parentheses lines. In addition, the mesolabial fold, the folds around the lower mouth, also called the marionette lines. These areas have thicker skin, but still have a fair amount of active movement when smiling and talking. Both of these types of folds around the mouth become deeper due to volume loss associated with aging. These types of fillers that can be useful in this area include Restylane Refine, Restylane Define, which can last about 6 to 12 months. A filler like Juvederm Velour can also be used and lasts about 18 months. The thickest hyaluronic acid fillers can be used on bone structure and in an area which doesn't really move with facial expression. Areas where I use these thicker fillers include the upper cheeks, the jawline, and the chin. These areas are prone to bone loss, which naturally occurs with aging. The cheeks appear to deflate due to diminishing cheekbone structure, as well as loss of muscle and soft tissue. The jawline may appear to sag and lose continuity due to hollowing of an area called the mandibular notch. The chin can lose projection as bone continues to decrease. I prefer to use a filler like Juvederm Ultra Plus, which can last about a year, and Juvederm Voluma, which can last up to 2 years. A filler like Restylane Lift can also be applied in these areas and can last up to 18 months. Successful placement of facial fillers for diminishing facial volume at the cheeks, chin, and jawline is highly dependent on technique. Most doctors place these fillers more superficially at the dermal and fatty tissue layer. At this level, the skin cannot support a significant volume and can actually be weighed down by the filler. The fillers can shift and make the face look doughy. I use my experience as a facial cosmetic surgeon with extensive work in placing facial implants to place fillers at these deeper layers, which are on top of the bone structure and under the muscle layer for more natural looking results. This technique is called structural volumizing and is a technique practiced by very few doctors. It results in a more defined and balanced facial structure and can even have a lifting effect. By restoring volume at the bone structure level, the skin and soft tissue that may appear to have collapsed and descended due to volume loss becomes more defined, and the overall effect can produce a vertical lift. Structural volumizing requires more filler than traditional filler placement, as the material is placed at the foundational level of bone where most of the volume loss occurs. Therefore, more volume is necessary. At this level, results can actually last longer than more commonly performed superficial filler placement. This is an exciting time for people interested in improving their appearance with safety, predictability, and convenience. In my practice, the use of hyaluronic acid fillers has been a great tool for me to help my patients. I would remind anyone considering having fillers to understand that fillers are just tools or materials used in the hands of a sculptor. The doctor's expertise, experience, and artistry are critical to achieve the best results for you. Recognizing that filler placement needs to be done at regular intervals, it's very important for you to find a doctor who you feel comfortable with. This means someone who shares your aesthetic vision, who communicates well, and makes you feel at ease. I hope you found this information helpful. Thank you for your question.